the benefits of exercise for prostate cancer. So, Dennis, have you got blokes doing exercises regularly?
Some are, some aren't. You have to remember too that prostate cancer support groups generally are made up of men with a range of ages and physical mobility. So I think we've emphasised already, and it's very good, the importance of continuing to do the pelvic floor muscle exercises. I think some men do it for a certain length of time, then they stop, and then they wonder why incontinence starts to come back. I'm 3.5 years past surgery now. I'm still doing those sets of exercises, basically what Joe just outlined, every day. If I don't, then I start to leak. Now, exercise, the younger men in my group, yes, they're pretty keen on exercise, and those in particular, those who were very physically fit before they had surgery or treatment, they recover much more quickly than those who aren't. And if they continue and get back into their exercise quickly, they find that more rapidly improves their continence and other aspects such as sexual function. Those of us who are older may be finding it a little bit more difficult to do a lot of exercise, but I personally try to do what I can. I have other reasons why I can't do a lot of cardio exercise these days, but I do a lot of stretching and a bit of strengthening through doing push-ups and that sort of thing. So yeah, and if I don't do that, not only does it sort of, I think, impact my continence, but it impacts my general well-being. And that has a lot to do with continence and confidence about whether you can maintain continence or not, is what I find.
Yeah,
it's good for your mental health.
Yeah. So, ladies, when you're seeing the men come in here to your clinic, do you talk about the importance of maintaining a reasonable amount of exercise to keep everything functioning well?
Absolutely. I tell them before their surgery that, you know, the better shape they're in going in, then obviously the better shape they're going to be coming out of it. Obviously, they have to modify their exercise regime because, you know, lifting, etc., following their surgery. But there are gentle exercises that can be done. There is some certainly studies going on in WA and through some of the universities. They have exercise regime programs. So yeah, definitely.
Yeah, and I always inquire and just make sure patients are walking every day. So being up on your feet just helps your pelvic floor, but also it's really great to potentially help things like bone density, cardiovascular health. And if you can't walk on land, perhaps you can walk on water. So we actually know that, or in water, should I say, we actually know as well, if you can do half an hour walking or about 150 minutes per week of that low intensity exercise like walking or swimming, it's really advantageous for prostate cancer. In addition to that, more vigorous exercises, and this is for all cancers as well. We now say exercise is medicine across the board. You'll actually get really good benefits, and like 61%, for example, prostate cancer survivorship simply by doing 3 1-hour more intense exercise sessions per week. And that includes something like a cardio and resistance program, like a circuit training type session, or a game of tennis, something that's a little bit more raising the heart rate. So overall, 150 minutes a week of walking and 3 hours, if you can, 2 or 3 sessions a week of a bit more intense exercise is really good for reducing the prostate cancer mortality, if we're talking about that group, but just overall cancer incidence and lowering the risk of overall other health issues. So walk away.